Depression is on rise in India. And Lucas, you have done a lot of work in depression and mental space. Would you speak some about the work that you have done?
Yes. Well, I was depressed myself. I'm a psychotherapy researcher in a way, and I've been teaching psychotherapy for a long time. And then I slowly came to some views that I share with other psychotherapists who were depressed themselves. And you should know that maybe 30% of all people is depressed at some point. So it's not something special. I'm sure that I was depressed 4 times in my life or so, and I'm not an exception. And especially the depressions where you don't know where you're depressed about. So sometimes people are depressed because they lost some relative or they lost their job, and they lose their perspective. So when you check them out and you ask them, where's your future? Then they cannot point much at future because their future is gone because of what happened. But there's also a category of people who are not in mourning, not in grief, didn't lose anything, have no typical traumatic experience, but are depressed anyway. And they get up every day with a lot of tiredness, and they may go to work and do their things, but it's all very heavy and difficult. Now, what I found out, and we are doing research on that for several years now, is that these people are often repressing some important life issue. Just in the sense that in psychoanalysis, people believe that repression could do something, and so that you block it out, don't want to think about it anymore, and then slowly it is out of your mind. You have forgotten it in a way, but it's still there. And it appears in areas of blackness, of darkness in your experience. And these areas of darkness, they create the depressed symptoms.
May I ask you to explain further, what do you mean by darkness in your experience?
Yeah, so you could say there's the outer landscape of perception. So when I look at the camera, there's the camera. But at the same time, when I'm talking, I have all kinds of thoughts, and these thoughts are happening in the space around me. And so when I just mention a chicken or something, so at the moment this appears somewhere, and this is not there for real. It's just in my mind, that my mind projects it there. And in the research into human experience, we look at this. We look at how thought is projected in space. And one of the phenomena that we came across is these areas of darkness that are, of course, quite subtle, but they seem to signify repressed issues. And by getting access to them, so finding out where they are, and then doing something to them and help people to get back to what they repressed, we have access to what needs to be changed in the form of psychotherapy. And by just doing this, which is often a playful procedure, so a lot of people think of psychotherapy, then I need to go through everything again. Not at all. So when we do this, it's just looking back a little bit on what happened, but for the most, it's finding ways to deal with that from the present to the past. We have many people who gave up a certain vision of the future at age 5 or so. They totally forgot about that, but still this is hampering them in the shape of these dark areas. And when we get to their dark area, we can find what it was and then help them to find a solution for this.
So does this take a long time? How many sessions for working through this?
This is the hardest part for most clinical psychologists and psychiatrists, that when we work in this manner, it's only one session. and sometimes it's even not a long session because you go directly at the issue, and we have methods developed to increase the creativity of the client to resolve something that as a child or maybe 10 years ago or over their normal repertory they couldn't deal with, but then we help them to still deal with that.
So do they have to go and unblock or unrepress those experiences?
Yeah, well, this will happen within the frame of the work, but it's not so much traumatic experiences that do provide people with this type of depression. It's often just something that they know, yeah, that was difficult and I didn't succeed in dealing with it, so I try to forget. And so often there's not strong emotions involved, not much pain, but just looking at it and then deciding, okay, when I would have a new chance, what can I do to overcome it? And by doing that, they can then the black areas that cause the symptoms, so they block the view of the future and also of they're in between people, so it's like there's here maybe a haze, a black haze, and I cannot see you as you are because I have a filter.
You have a filter.
And also this filter consumes mental energy because it's of a inhibitory nature, and this is the type of neural activity that asks for inhibitory neurotransmitters, and these are always involved in selective attention and recovering during night and things to get fit and clear in your mind. So when these are occupied with something else, like keeping something repressed, then it takes away a big part of your mental energy, you could say, your mental capacity.
So let me repeat. You say that this darkness is a real experience in the mental space of the patient, of the client.
Right.
And within one session, in a very playful way, they can access whatever was the issue that repressed in terms of what is required in the present to move into the future.
Right.
Is that?
You cannot say it better. Yeah.
Okay.
Yeah.
So how does one go about learning this? Like how will a psychologist or a therapist learn this? What tools is required?
Well, the tools are based on hypnotherapeutical and NLP-like technologies, so also imagination therapy. So therapists that are modern in the sense that they know the power of imagination and they use this, they will have easy access to this, and they can come to a workshop where they can learn it in one day, and maybe they want to learn things around it because this is this one type of depression, but they may also want to know how to treat a depression where the future is gone, or when there's grief involved or trauma. So often when I teach something, then all types of depression are often included, so that because the thing is that a lot of psychotherapists, they learned that depression is more like infectious disease, and some psychiatrists also believe that it has the same thing as infection. So, and some of the blood values and so show, okay, it's as if there's some infection. And then you think of treating it. It's something that slowly comes, and then you treat it for a long period of time with pills or psychotherapy or group sessions, and then it slowly goes. But this is a view where you don't look at the mechanism behind it. So we believe that the mechanism behind it can be known, and when you understand it, you can be far more effective in the treatment.
So you, in your experience with many clients, have experienced that clients have easy release from depression within a session or two.
Yeah.
Would you speak some about your research?
Now, first I need to say that some clients have 2 or 3 or 4 of these repressed issues, and that makes it a little bit more complex. But they show up as multiple black areas. So when you know the methodology, you can see, oh, okay, we need to work with this first, and then we move over to that one. But in the research, we work as if. So we have an experiment, run an experiment in the Netherlands, where we work as if there's only one. And so we need to limit it to make it comparable and so that it fulfills the rules of science.
Yes.
So some clients, they are not fully helped. So they need some other treatment or next session because there's still some left. But we have a lot of clients who are relieved in one session just by using this procedure. And now we're still working on it, so I cannot give numbers or so. Only that I know that in my practice and of many people that I know that use the same method, in the Netherlands it will be about, now we have trained about 60 people who
60
know,
therapists?
60 therapists who know to do it. Now we are not phoning every day with each and everyone, but there will be quite a lot of people who know how to use this. Then also abroad, so in Finland and in Germany, people were trained in this, and when people have a lot of background, they can pick it up quite easily because they understand, and then, good idea, and then they just can do it.
So, you said different kinds of depression. What about intergenerational depression? Is that also seen in clients?
Well, what do you mean by that?
So supposing if the mother had depression, has suffered from, is the daughter also suffering from depression? Can this work also help them?
Okay, so I didn't, now I know that it's intergenerational. Generational, and I thought intergender, and so then it's a phenomenon that you see in other things, that children do repeat the symptoms of their parents, and it may show up when we do this work. So when you follow the simple procedure that we use in the experiment, it may not show up, maybe, so because we don't ask for it. But when you work as a clinician with some experience, then you may ask a little bit more. So something that I do a lot is ask the client, "What's your theory? How do you think this came about in your life?" And then they may say, "Yeah, well, I think it's in my family because my mother." And then I know, okay, I need to look at that too. Okay. And I have experienced that it's, and you probably too, and that you know, okay, there's a connection between the mother and the daughter, and the daughter doesn't know why she's depressed because there's nothing in her life to make her depressed, only a very intense identification with her mother. So when she's very much connected to her mother, then she may also repeat something like this. So I found this.
I think this is a fabulous way for so many people who are suffering from depression, sometimes for years together, and young people suffering from depression in their very young, prime time when they're going into school, higher education, college. This can be a very easy way for them to move forward into their future. Yeah,
well, my idea is it may not help everyone, but it should in fact be the first thing to try because it's so little effort. And so when every clinical psychologist could do something like this, it's only one session and you learn a lot about the client when you just go over it. And you always can give them pills or you can always do something else. I think there's of course successful ways of dealing with depression that are more specific. Like for instance what I learned in the 70s, we had sleep deprivation. And it was interesting that people with certain depressed states, when they didn't sleep one night, next day they felt much better. And it's very interesting that it could happen. Now, of course, when you go running and a lot of movement and healthy food, stop your habits of smoking and drinking, and so then you can be a little bit more proud of yourself. So this can already be things that break the depressed state. But it's often very hard for a depressed person to take the effort to do some more, because they already have the idea that they try maximum effort to stay on their feet. And then when they say, yeah, you should go running twice a week or so for 15K, they say, yeah, a good idea, but then...
Yes.
But it would be a lot improvement.
Thank you, Lucas. Viewers, whoever you listening to this and watching Dr. Lucas speak about mental space and depression, we are bringing him to India next year, 2020, to teach us on how we can use mental space psychology to work with depression. Do send your comments down in the link below and write to us. We'll be happy to respond to you on how you can access this course and help your clients to work with depression much effectively. Thank you.
Thank you.